Good evening and a very warm welcome to all of you who are joining us for our all candidates town hall, Vancouver Granville and Vancouver South. My name is Gita Chud and I am co-president of the Jewish Seniors Alliance, more commonly known by our acronym JSA. We'll begin this evening with a land acknowledgement, expressing our respect and gratitude for gathering on the Indigenous lands, pardon me, of the Musqueam, Squamish, and Tsleil-Waututh peoples. A friend very recently sent me something that she added to a land acknowledgement she had given. I found it very powerful and I'd like just to add it. She says, "Let us attend with great care to the history and stories held in these lands, listening hardest for those that are silenced by others." Tonight's gathering really reflects and, exemplifies the key goals of our Jewish Seniors Alliance. And those are outreach, education, and advocacy. So our advocacy committee, led by Tony Dumoulin, who you will meet later, came with the idea of hosting, a meeting of candidates in these particular ridings. So pretty immediately after the idea came to be, we did an outreach to other seniors groups in our general geographic area, and they reached back to us extremely quickly to say they were very keen to co-host. So in that regard, joining us tonight, we have the BC Health Coalition, COSCO, the Council of Senior Citizens Organizations, Marpole Oakridge Family Place, South Granville Seniors Centre, and South Vancouver Seniors Network. And so together we are collaborating on both the planning and the presentation of this town hall. The second key pillar or goal of our Jewish Seniors Alliance is education. And so this evening, we look forward to all our panel members educating us about their primary platforms that they're going forward with in this federal election. And the third key pillar is advocacy. Advocacy particularly for seniors or older adults. So tonight we have framed a number of questions that we are going to pose to our panelists regarding specifically plans of their party in terms of serving and services to seniors. So we are certain that it is going to be an educational evening, an advocacy focused evening, and in terms of outreach, while we'll likely still have many people joining us, we had close to 350 people register for this evening's session. It's now my pleasure to introduce Diane Wood. Diane is going to serve as our moderator for this evening, and approximately a 2-hour time frame, 7 o'clock to 9 p.m., has been allocated for this particular webinar, which is also being recorded. So hopefully if you have friends or family that you would like to be able to tune in later to the session, the recording will be made available. Diane Wood is Vice President of COSCO and for decades has served as a strong activist and advocate for both local and global issues, all related to social justice. And so, dear Diane, we thank you, we welcome you, and the floor is now yours.
Thank you very much, Gita, and hello, everyone, and welcome. I'm joining you from the unceded and traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. This all candidates meeting on seniors issues is being held virtually via Zoom webinar. We have all been brought into this new age, and we're very grateful due to the circumstances that it is a source that we can use to communicate with each other. And a lot of us have been doing that. Thank you to all of you for joining us this evening, and especially to the candidates who are present with us. 8 candidates from 6 parties. This webinar is intended to help us understand where each of the parties stands on the issues that are of great importance to us as seniors, and therefore to help us cast our votes. To that end, the format of this evening's webinar will be as follows. Each party will have 2 minutes to describe their party's platform for seniors. The party's speaking order was chosen randomly by a draw. This will be followed by 5 questions based as to each of the parties. A representative from each of the co-hosts will ask 1 question. The candidates have been provided with the 5 questions in advance. Each party will have 2 minutes to provide their answer to each of the 5 questions. Again, the order of what party will respond first to each question is by random draw. The order will be by party rotation, which I will provide. Following all 5 questions being asked and responded to, closing remarks will follow, which with each of the candidates being given 2 minutes. Speaking order again for that is by random draw. Now, some other information to share with you. There is a timekeeper. There's always a timekeeper, right? And our timekeeper will keep track of the candidates when speaking to keep them to their time. And they will be shown a yellow sign held up by the timekeeper indicating that they have 15 seconds left. And at the end of their time, a red card will be held up showing their time is up. And I think dear Gita is doing that. The chat and question function for this webinar is disabled. If participants have a question they wish to ask any of the candidates, they should email their question to Margot after the webinar. And for those who are watching this virtually, that information is up on the screen. But for those who may be on this by telephone, it is Margot, MARGOT, at jsalliance.org. So the information is up on the screen for you folks to note. Margot will forward all the questions she receives to the candidates for them to respond to the participant who asked the question. Finally, this event is being recorded, and all registered participants will be sent a follow-up email with a link to the recording. It will also be available on the BC Health website. You will be able to share, as Gita has said, this recording with your organizations, your members, friends, and family. I will now introduce you to the 8 candidates, which I believe will also be shown on the screen or was already up on the screen when some of you were waiting to come in. And so I will go through that now. And I will also advise you of the party that they are running for in this election or are already serving as an MP. First is Mr. Harjit Sajjan, who's with the Liberal Party of Canada, and the riding that he's running in is the Vancouver South riding. Kaylin Che is the Conservative Party of Canada, and she's running in the Vancouver Granville riding. Sean McQuillan is with the New Democratic Party of Canada and is running in the Vancouver South riding. Anjali Appadurai is with the New Democratic Party of Canada, and she is running in the Vancouver Granville riding. Imtiaz Popat is with the Green Party and is running in the Vancouver Granville riding. And Damien Jewett is with the People's Party of Canada and is running in the Vancouver Granville riding. Anthony, who I believe is known as Tony Cook, is with the People's Party of Canada, and Tony is running in the Vancouver South riding. Anne Jameson is with the Marxist-Leninist Party, and she is running in the Vancouver South riding. So those are the candidates that you will be hearing from this evening. I will now invite a candidate from each party to describe in 2 minutes their party's platform for seniors. Candidates will speak in the following order. Ms. Che with the Conservative Party, then Mr. Popat with the Green Party, then Mr. McQuillan of the New Democratic Party, then Mr. Sajan of the Liberal Party, then Ms. Jameson with the Marxist-Leninist Party, and Mr. Jewett of the People's Party. So the floor is now yours, Ms. Shea.
Thank you all for being here today. As we all know, COVID-19 has negatively impacted all Canadians, but has been especially devastating to Canada's seniors. It's shown us the failures of our long-term care system and the failure of the Liberal government. We've had shortages of long-term care beds for years, but for 6 years, the Liberals have failed to do anything to solve this dangerous problem. Now they're asking Canadian families and seniors to participate in an unnecessary election to give them another chance while Canada is about to enter a dangerous fourth wave. Canada's Conservatives have a plan to secure the personal and financial future for seniors, a plan that helps seniors stay in their homes, improve the quality of long-term care, and protect the security of their pensions. Trudeau wants to persuade Canadians that Canada can spend and spend without consequence, that the inflation that is rippling across our economy doesn't matter, even though the price of food, shelter, and fuel has gone up for all Canadians. While inflation may not hurt the rich elites, it will hurt the middle class and seniors with fixed retirement income. Unlike the Liberals and the NDP, Conservatives understand that money does not grow on trees. We cannot solve the issues facing British Columbians, including housing affordability and climate change, if Canada is saddled in debt for the next 50 years. To ensure continued funding for core Canadian social programs, including the ones impacting the lives of seniors and the most vulnerable, we must grow the economy, and we cannot grow the economy unless we live within our means. It's time for a change. Canadians can restore accountability and fiscal responsibility in Canada by electing a strong Conservative government on September 20th.
Thank you, Ms. Shea, and you were certainly right on time. We appreciate that very much. We'll now hear from Mr. Popat of the Green Party.
Thank you for having me today with this important topic. In recognizing that I'm speaking from the unceded homelands of the Tsleil-Waututh, the Musqueam, and the Squamish. We also recognize their tradition of taking care of Mother Earth and recognizing that Mother Earth is the oldest senior citizen. And when we talk about seniors issue today, that's very important. I think that this election is about priorities. And for me and the Green Party, I think it's a priority to invest in long-term care and not in pipelines. We just saw in this pandemic the havoc, the lack of care we've seen in long-term care because there has been no standards and there's been little investment. If we can buy a pipeline, why can't we not spend money and put money into long-term care, into home care, into seniors housing? this is a commitment that we want to make and we want to see in this election. And that's what it is about. It's about priorities. So thank you for having me here.
Thank you very much, Mr. Popat. Now we'll move to Mr. McQuillan of the New Democratic Party.
Hi, everyone. My name is Sean McQuillan. I'm the NDP candidate for Vancouver South. I have a nonprofit that helps caregivers in the film industry. And when I think of senior care, I think of my mother-in-law, Giselle. She's the only parent left between my wife and I, and she has Parkinson's. And her experience with home care has not always been consistent. So what we want to achieve in Canada with the NDP is wraparound supports for seniors. And that means dental care, pharmacare, vision, and mental health supports. And with mental health, I mean creation of community supports so that seniors have a sense of belonging. With that, we want to deprivatize long-term care homes, and taking up the profit-driving care means that we don't cut corners. And to ensure that we don't cut corners, we want to work collaboratively with patients, caregivers, and provincial and territorial governments to create national standards for care and home care and long-term care, regulated by the same principles as the Canada Health Act. And in doing so, we would legally protect access to home care and long-term care services and create consistency across the country. The standard of care is not improved under the Liberal government, and it certainly didn't under previous Conservative governments. And to touch on what the Conservative candidates said, to pay for it, we're going to institute a wealth tax so that we are more equalized in our society. And so our seniors are some of the hardest hit over COVID-19, and they struggled with isolation. And life through the pandemic had little options for them, and yet still Trudeau did nothing. So when you think of the kind of future, not only for yourself, but for all seniors yet to come, I want you to vote for Better with the NDP to create national standards that will ensure all seniors can live with proper supports and dignity.
Thank you, Mr. McQuillan. We'll now move to Mr. Sajan.
Thank you very much. I too want to acknowledge that that we are on the unceded territory of the Coast Salish peoples. I want to first of all state how difficult this pandemic has been on seniors, and we have seen this firsthand. And I want to say that a re-elected Liberal government will continue to making life more affordable for seniors by increasing the guaranteed income supplement by $500 for single seniors and $750 for senior couples. We'll help seniors stay in their homes longer and work with the provinces and the territories to improve long-term care so that seniors are safe and comfortable wherever they live. Now, this builds on our actions we've taken before and during the pandemic, which includes restoring the retirement age from 60, that was originally for 67 back to 65. And let's not forget, it was the Conservatives who did this, and we have reversed this. So Aaron O'Toole says he wants to take Canada back. Well, guess what? He's going to take back and go back to what the Conservatives had done before. Now, this, by increasing the GIS, which I want to state here, over 900,000 seniors have impacted 900,000 seniors and lifted 57,000 out of poverty. And we're providing more than $900 for seniors and $1,500 for seniors couples. So on top of regular benefits for low-income seniors, this will support seniors in getting through this pandemic. Now, we have seniors back all the way through this pandemic, and we will continue to support our seniors all the way through. Thank you.
Thank you very much, Mr. Sajan. I'll now call on Ms. Jamieson. Ms. Jamieson, are you there?
I'm just unmuting it. Thank you.
Okay,
Yeah.
Thank you very much.
All right.
The floor is yours.
I would like to draw your attention to a renewal update, which comes out every day during the election by MLPC. And if you go to this particular website, www.cpcml.ca, you'll be able to look at our program in more detail. So I'm just going to go over just a few aspects of it that are, particularly of interest to seniors. A new direction. We need a new direction for the economy. And part of that is stop paying the rich, increase funding for social programs, no privatization of social services and institutions. Now, when we say stop paying the rich, there are many aspects to that, to carry that out. A moratorium on the debt. We should have a public banking system, not the private charter system through which banks can lend out money they don't have and get huge billions of dollars in interest fees. So this is a large part of being able to finance increased funding for programs for seniors. We need to establish now this part is many seniors like myself. We're very active in the anti-war movement, starting with the movement to get US troops out of Vietnam. So we see this part of the program as very important. Establish an anti-war government, get Canada out of the US war machine. That's very important as far as the justice of that issue, as well as decrease. Thank you.
Thank you very much, Ms. Jameson. We'll now move to our final speaker, Mr. Jewett of the People's Party. Mr. Jewett, the floor is yours.
Thank you for inviting me to this event. C'est un plaisir d'être ici aujourd'hui. It's a pleasure to speak to the Vancouver Granville community and present our plan for ensuring a strong and prosperous future for Canada. The People's Party is a Canadian populist party with conservative and classical liberal principles and some libertarian influences. Populist here meaning we're fighting for everyday Canadians, not elitists, not lobbyists, not special interest groups. We work to represent the people directly. We believe in small government, lowering taxes, ending corporate welfare, and supporting small businesses. We believe in maximizing the freedoms that Canadians enjoy, and the PPC will always put Canadians first. Me personally, I'm not a politician. I'm a regular everyday working Canadian who cares deeply about his country. I work as an IT consultant and web developer, and my day job is not easy. I'm here today not because I want to be, but because I feel I have to be. I do this on my own time, outside of work, with some donations and with my own money. Our country is slipping away at an alarming rate, and establishment parties keep proposing more and more spending and wasteful programs that dig us deeper and deeper into a hole. My fear is my children and my children's children will be paying for the problems and wasteful spending solutions of our generation. My fear is that Canada will be in no position to deal with the next global crisis whenever it should occur, whether it's a recession, another pandemic, or something else. So today, my colleague and I will present you a principled approach to a fiscally responsible and economically strong Canadian future, including for our seniors. Thank you for taking the time to listen to our plan, and we look forward to a great discussion here today.
Thank you very much, Mr. Jewett, and thank you to all of the candidates for doing such a good job on sticking to your time. That's very much appreciated. Would I just remind the candidates, if you're not speaking, if you could turn off your video, please, and then turn it on when it's your turn to speak. Thank you very much. Now, the next section of our program this evening is to ask a representative from each of the 5 co-host organizations to pose a question. Each questioner will have 2 minutes to introduce their organization and then ask their question. 6 candidates, 1 from each party, will be given 2 minutes each to answer. All candidates have received the questions in advance, and the questions will be asked by the co-hosts in the following order. First, co-host questioner will be Ms. Barb Mikola. Secondly will be Mr. Douglas Dunn. Third, Mr. Tony Dumoulin. Fourth, Miss Betty McGee. And fifth, Miss Andrea Grobian. So again, the timekeeper will hold up a yellow card when candidates answering the questions have 15 seconds to go, and a red card will be displayed when their time is up. So the first person to ask a question is Ms. Barb Mikola. Barb, the floor is yours.
Thank you so much, and welcome everyone. I'm very proud to represent the Council of Senior Citizens Organizations of BC, COSCO. It's not the big box store. COSCO is a council and an umbrella group of 64 organizations in BC. We advocate for health issues, housing, income security, and transportation for seniors in BC. And we have a motto, plan with us, not for us. So our website is COSCO BC.org if you would like to check that out and join us. The question I'm going to ask for the panelists tonight to please answer, this one is on national pharmacare. Many seniors are on tight budgets and must choose between proper nutrition and prescribed medications. Does your party's platform for seniors include support for a national pharmacare program, at least for seniors, and how would you fund it? Thank you.
Thank you very much, Ms. Mikulik. And I will just do a little bit of an explanation on how we'll be handling the questions and moving through each of the parties. So the answers to each question will be rotated through a party order so that the answers to the second question will come from the second party in the order. And this was the questions where the order was selected by random. And I will provide you with the order before moving to the response on this question on national pharmacare. So the first person candidate will be from the People's Party of Canada, then the Conservative Party, then the Green Party, then the New Democratic Party, then the Liberal Party, and then the Marxist-Leninists. So the first party to respond, and I believe that is you, Mr. Cook, from the People's Party. Thank you. The floor is yours.
Thank you very much. Fundamentally, the People's Party of Canada is in favor of decentralization of government, ensuring that responsibilities are divided between federal, provincial, and municipal governments as per our Constitution. This means, of course, that health is a provincial responsibility. We are not proponents of a national pharmacare system, thus we do not have a platform position on this topic. The best answer we have for the issue of affordability for those on fixed and low incomes is better fiscal management. Our current national debt is $1 trillion, and the Parliamentary Budget Office reports that they expect a $3.7 billion or trillion dollar debt before the Liberals finally balance a budget in 2070. This is just not good enough, and Canadians deserve a government that respects and properly manages our finances. Deficit spending has been the norm since the current Liberal government was elected, not just during the COVID response. This poor fiscal management has created a massive debt for future generations to deal with, but perhaps worse is the unfunded spending supported by the printing of money, which is a major cause of inflation. We propose to support fixed and low-income Canadians by stopping these inflationary monetary policy and thereby ensuring that the value of their dollar remains steady. Lost purchasing power is nothing but a hidden tax caused by poor fiscal management. Every unfunded promise from a legacy parties puts Canada's future generations farther in the hole. Fixed and low-income Canadians are disproportionately affected by inflation. The People's Party of Canada is the only federal party not trying to buy your vote with new spending of borrowed or printed money. I would encourage everyone to go to the website at www.peoplespartyofcanada.ca and look at our entire platform. Thank you.
Thank you very much. And our next response will come from Ms. Che, the Conservative Party. Ms. Che?
Thank you for the question. The Liberals, as you know, have for years promised national pharmacare, and for the last 6 years have failed to deliver on this promise. As we all know, provinces have jurisdiction on health matters, and the Conservatives believe that we should respect and support the provinces without intruding on their jurisdiction. Instead of making Canadians wait another 6 years for a national pharmacare plan, the Conservatives will immediately boost the annual growth rate of the Canada Health Transfer to the provinces at least 6%, which equals an additional 60 billion to our healthcare system over the next decade. This will allow provinces to focus their support on the seniors and the most vulnerable rather than allocating resources on those who need it least or already have duplicate coverage. It should also be noted that promise payments for medication means very little if Canadians cannot get that medication in Canada in the first place. COVID has brought to light Canada's limited pharma production capabilities. The regulations of the Liberal government in the last few years has driven pharmaceutical companies out of Canada, leaving Canadians near the back of the line for vaccines and new medicines. Canada's Conservatives have a serious plan to increase the domestic production of vaccines and to strengthen our pharmaceutical supply chain so that medicine can be affordable and accessible for all Canadians.
Thank you, Ms. Jay. Our next party response will be from the Green Party, and that's MTS Popat. Mr. Popat.
Thank you very much for the question. The Green Party fundamentally believes in a holistic approach to medicine to care our people. And that means expanding our current notion of Medicare to include Pharmacare, to include dental care, and other forms as well, including traditional medicine, which is not currently as much covered. So people, including seniors, have different ways of making sure that they're taken care of, because different modes of medicine doesn't always work for everybody. I know a lot of people pay out of pocket for additional medicine, such as vitamins or supplements or traditional medicine, and they're not covered, and they should be covered. So yeah, of course, include Pharmacare, include dental care, and we should also include all that above as well. The Green Party also believes in universal, basic universal income, which would be a safety net for everybody. So I'm a junior senior. I'm 50, turning 58 now. So people like me who are not 65 yet, and I know they're talking about lowering the age, we're not covered. So overall, I think we need to look at the whole picture of how everybody is taken care of. So definitely, yes, we do believe in Pharmacare and dental care, and we can pay for it because, if you can buy a pipeline or spending money on, the army and so on, it's about priorities. And if you look at our demographic, the senior demographic is growing. The senior population is growing. So we have to invest in our seniors because we have lived in this country for a long time. We've done our bit and we've served the country, and it's about time that we be taken care of. Thank you so much.
Thank you very, very much. We'll now hear from Ms. Abadura from the New Democratic Party of Canada.
Hi, thanks so much for the question, and thank you for having me here today. Sorry that my lighting situation has got a little dark here. The pandemic, as other candidates already said, really exposed some deep failures in our system. And primarily and most horrifyingly, it exposed the failure of our current for-profit long-term care industry. And so part of that is the lack of free and universal medical access, particularly for seniors. So the NDP is committed to universal pharmacare. That's a commitment that we've been rallying for a very long time, and the pandemic has showed us that it's so important to have strong public health care. The choices that seniors have to make right now are absolutely unacceptable. And for the past few years, the Liberal government has been protecting a very broken and inequitable US-style system based on private insurance, which has been shown to deepen inequality. It means more premiums, co-pays, and deductibles that are being paid out of pocket and forcing these difficult choices, like the one you mentioned between food and medicine. The Liberals also voted against universal pharmacare, and that was in the direct interest of Big Pharma. So we have Big Pharma very much in the pocket of the Liberal Party right now. So we need quality prescription drug coverage for everyone, and particularly for seniors. And this is a plan that will actually eventually save us $4.2 billion. And we'll use that money to give even better drug coverage to all Canadians. Our seniors deserve it. They've worked so hard and they've contributed all their lives. So this is the very, very least we can do to prioritize free and universal pharmacare for all.
Thank you very much. We'll now move to Harjit Sajan from the Liberal Party of Canada.
No, thank you very much. And to answer the question very directly, the answer is yes. It was actually in our 2019 platform where we started the work to have pharmacare across Canada. And but the work even started before this in budget 2018, and that work is still ongoing. In fact, we've already signed the first provincial territorial agreement with PEI to accelerate the implementation of a national universal pharmacare plan as a pilot project. And in addition to this work, we've also invested $500 million nationally to a national strategy for high-cost drugs for rare diseases. Now, this is an active and ongoing discussion that will require federal and provincial level to build to work together. And in budget 2018, we announced the creation of the Advisory Council on the implementation of a national national pharmacare, and that work is ongoing. They tabled a report in 2019, and now the work is continuing with the provinces and the territories conduct roundtables, including discussions with Indigenous leaders across the country, because this is something is quite complex and it has to be done with the provinces and territories and Indigenous leaders across the country to making sure that we get this right. Plus, we've also laid out an outline which we have been working towards government collaboration, we created the Canadian Drug Agency, which is developing a national formulary, implementing the national formulary and a national strategy for expensive drugs for rare diseases. And in early 2021, we named the head of the Canadian Drug Agency Transition Office, Susan Fitzpatrick, who will be helping to develop the national formulary with experts to create consistent access across this country. And when it comes to drug access, let's not forget, it was actually under a conservative government where they put in policies in place that allowed our drug companies to actually leave, which left us in a significant predicament during this pandemic. Thank you.
Thank you very much. And our final person to speak on this is Anne Jamieson from the Marxist-Leninist Party. Anne?
Hi, yes, can you hear me?
Yes, Ms. Jamieson, please proceed.
Okay, hi, yeah. All right, yes, a national pharmacare program should be part of a healthcare program, which actually should be free to all. Now, if a small country like Cuba, despite the embargo by US and sanctions by the US, can do this, surely we can too. But a pharmacare program needs to be all-sided, and it must encompass the development, research, production, and delivery of pharmaceuticals with the aim to serve the people, economy, and society, and not the global rich. So this requires human-centered public enterprises to organize the necessary research and develop, produce, and deliver pharmaceuticals to the people without any aspect being infected with the imperialist aim of private maximum profit.
Thank you very much. Now that concludes our first question. And so we'll now move to our second question, which is going to be posed by Douglas Dunn. The floor is yours, Douglas.
Good evening. Thank you all. The South Granville Seniors Centre is an independent centre located in 12th and Granville in Vancouver. It's the social information and referral, education and health programming centre for the community. And we're considered the community living room for seniors living in the South Granville area. One of the things that affect many of our members, which is of vital importance, since many of them have been residents for 30, 40, or 50 years in buildings that are now extremely expensive, what measures will your party take to protect all accrued pension benefits, support defined benefit pension plans, and protect retirees if their employer becomes bankrupt?
Thank you very much, Mr. Dunn. We'll now move to the list that I'm working from, which means we're now starting with the Conservative Party to respond, and that would be Ms. Che. The floor is yours. Ms. Che, are you there?
Apologies, I was having
Thank you.
trouble. And I lost a bit of connection. Can you just brief me on what the last candidate said?
Mr. Dunn, can you just repeat the last part of the question, please?
Certainly. I'll just read the entire thing. What measures?
No,
would
just
require-
it. I think just
Just
the
the
last
last part.
part.
Okay. Supports defined benefit pension plans and protect retirees if their employer becomes bankrupt.
Thank you very much. All right, we'll now start the time for you then. Now, Ms. Che.
Thank you for this question. Just 3 years ago, Sears Canada employees woke up one morning to find their pension checks cut by 30%. And before that, in 2009, lifelong workers for Nortel, Ontario woke up one morning to find their pension checks also cut by 30%. So imagine waking up one day and finding 1/3 of your life savings just gone, because that's what it means when pension benefits are cut. Conservatives understand the devastating impact this has for seniors who have worked hard to secure their retirement. That is why our party is committed to changing corporate behavior and making corporate Canada accountable to all Canadian pensioners. If elected, the Conservatives will propose new legislation to put pensioners at the front of the line during any bankruptcy or insolvency proceedings. Today, pensioners stand at the back of the line behind so-called secured creditors, such as multi-billion-dollar private equity firms. That is just not right when pensioners have devoted much of their lives to these companies. Conservatives will also be putting forward legislation to prevent executives from paying themselves while restructuring unless a pension plan is 100% fully funded. These are examples of some of the measures that the Conservatives will be implementing to realign corporate Canada with the interests of pensioners. It's time for the government to protect the financial security of seniors.
Thank you, Ms. Che. We'll now move to the Green Party of Canada. Mr. Popat.
Yeah, thank you very much for your question. I mean, not everybody has pensions because, they may not be working, they may be low income. So we need to find ways to protecting these pensions as much as possible. But that's not always possible. What the Green Party is proposing is a new safety net that has been actually talked about quite a bit, and a lot of other parties have talked about it, and there's been talk about some experiments around that as well, which is called the universal basic income. What that does is that it guarantees a basic income for anybody based on their income, based on their employment. So everybody's guaranteed a minimum of $48,000 a year after taxes. And that would combine welfare, EI, and things like that. So if everybody's guaranteed that, especially when they retire, that means they have that safety net. And there's been a lot of talk about that as well. And there's a lot of evidence to show that that can work. So yeah, while we need to protect our pensions, government pensions, private pensions, not everybody has CPP and or RRSPs and things like that. We need to take care of people who don't have that and protect people who do have pensions, but transition to a program such as universal basic income, which will make sure that everybody's taken care of, including junior seniors like myself, who are not 65. So we need a system, a safety net that does take care of everybody. We know we have all kind of programs that we brought in this country, including Medicare and so on, but now there's time for universal basic income to come to fruition. And that's what the Green Party has been pioneering, and that's what we would put forward. Thank you.
Thank you, Mr. Popat. We'll now move to the New Democratic Party, and that would be Mr. McQuillan.
Thank you. Thank you very much for the question. Canada, unfortunately, has a history of corporate bankruptcy that's resulted in pensioners losing the complete value of their pensions. As the Conservative candidate mentioned before, both Sears and Nortel had similar situations with this. In 2009, the pensioners had to fight for 7 years to get 40 cents on the dollar when initially they were offered 8 cents on the dollar, all while all of the executives received $190 million in compensation. Similar things happened with many other companies in Canada like North Star Aerospace and Sears. It's loss of pensions with corporate bankruptcy while the executives still receive millions in compensation. Now, to their credit, I'm going to say both the Conservatives and the Green Party are right in line with the NDP policy. And that is to make sure the NDP wants to end pension theft by ensuring that seniors with pensions are at the front of the line when corporations fall. And again, only if we enshrine it through legislation that pensioners are at the front of the line will we make sure that corporate malfeasance doesn't leave pensioners shorthanded. And much like the Green Party, we've had our MPs already fight in the House of Commons for guaranteed livable basic income. Leah Gazin introduced it from Winnipeg Centre in the 43rd sitting, and it was voted down by both the Conservatives and Liberal governments. So we want to create these kinds of supports, all wraparound supports, so that no matter what your working condition is, we are protected from corporate malfeasance and we have a safety net so that when something goes wrong, you're not left in the cold.
Thank you, Mr. McQuillan. We'll now move to the Liberal Party, and that is Mr. Sajan.
Thank you very much. Thank you. Now, it is absolutely unacceptable that some pensioners face hardship because of their employers' insolvency and underfunded pension plans. And this allows me to talk about the work that we did, our government did on this very important issue. That's why we made strong reforms to the Insolvency Act and introduced Bill C-97 to prevent this from happening. So Bill C-97, when we passed it, the major amendments to the Bankruptcy and the Insolvency Act. Now, this came to force back in November 1st of 2019. Now, one goal of these reforms is to make insolvency proceedings more transparent, fair, and accessible for pensioners and workers, which includes preventing CEOs and directors from getting payouts when workers have wages or pensions that need to be paid first, and also preventing creditors from having access to register disability savings in bankruptcy court. So the point is, we have already started the work on this, and we will work to make these laws even stronger to making sure pensions are protected. Thank you.
Thank you, Mr. Sajan. We'll now move to the Marxist-Leninists Party with Ms. Jameson. The floor is yours.
Thank you. Yes, to protect defined benefit pension plans is a very important issue in order for the right of seniors to a dignified life. This, in my opinion, the single most important or most effective method of protecting it is to do away with the Companies Creditor Arrangement Act, the CCAA. Since the 80s, this particular act has been used in a fraudulent way by corporations to declare bankruptcy when they are still making a profit, but not enough profit, not maximum profit. So it is a way to restructure, so-called restructure these companies, and the new owner, which swallows up the other one, divests itself or tries to divest itself of pension obligations. If any of the cartel parties are serious about protecting benefit pension plans, then they need to do away with the CCAA. And of course, it's already been mentioned that by several parties, the way in which through this act, companies divest themselves of pension obligations.
Thank you very much, Ms. Jameson. And our final responder to the question will be from the People's Party, and that is Damien Jewett. The floor is yours, Mr. Jewett.
Thank you for the question. And I'll admit I had to do some research on this one, but I'm confident that PPC has the best overall approach here. So first, I wanted to just talk about a little background info. The CPP is generally considered to be in good shape, and the reforms implemented in the 90s, such as the creation of the CPPIB, have done a relatively good job of ensuring pension funds are kept at arm's length from political interference and are managed responsibly. Regarding employer bankruptcy, pension plan funds are generally held in trust and don't form part of a company's assets. So there is some measure of protection for plan members in that way. Issues can arise regarding plan contributions that an employer has failed to remit during financial hardship. And there have been cases where court rulings were in favor of the pensioners. Responsibility from the personal level all the way up to the corporate level is one of the PPC's core principles. So we would likely explore options such as drafting regulations which prioritize plan members over creditors in certain cases, or perhaps the creation of a pension guarantee fund at the federal level, similar to what they have in Ontario, the Pension Benefits Guarantee Fund. So with that said, with that all said, the number one thing we can do to protect retirees' pension benefits is to lower and keep the inflation rate in check. Inflation erodes the purchasing power of people on a fixed income, and there is no pension legislation requiring retirees' benefits to be adjusted to provide inflation-related increases. The quantum theory of money tells us that the price of goods is generally proportional to the amount of currency in circulation. In other words, the more the Liberals print, the more CERB checks we write, $400 billion printed at this point, the more expensive everything will become. And this includes groceries, medicines, vehicles, etc. So we're seeing alarming rates of inflation under the Liberals.
Sorry, Mr. Jewett, you had reached your time, and Gita was flying the red flag there. So we thank all of you for your responses, and it's now time to move into our next question, question 3 on our list, which is going to be posed by Mr. Dumoulin from the Jewish Seniors Alliance. Over to you, Mr. Dumoulin.
Thanks, Diane, and good evening, everyone. First, I want to thank all the candidates for taking the time to participate in tonight's event. My name is Tony Dumoulin, and I'm the chair of the Advocacy Committee for the Jewish Seniors Alliance. Now, Gita Chud, our co-president, already spoke somewhat about JSA in her opening comments. So I think I'll just go straight to my question about national standards for long-term care. Now, this is a 3-part question, and I really hope that you candidates will answer all 3 parts in your turn. First of all, does your party support working with the provinces to establish national long-term care standards? Second, how would such standards be enforced? We've talked about the division between provincial and federal jurisdiction. How would the federal government be involved in enforcing national long-term care standards? And third, what specific standards would you or your party want established? And I'd like you to give examples of those standards. Thank you.
Thank you, Mr. Dumoulin. So that's a 3-part question, and we're going to start with the Conservative Party, and that would be with Ms. Jay. Oh, I'm sorry. I've got, that would be starting with the Green Party, and that would be Mr. Popat. Thank you.
Hi, thank you very much for your question. You know, my father actually passed away in long-term care just before COVID, and thankfully, because he didn't have to go through all that. And right now we're questioning whether to put my mom into long-term care. So it's a very, very tough question. We saw that what happened during the pandemic. Definitely, we need to see standards, which is a commitment from the Green Party for long-term care. I said in my earlier statement that we should be investing in long-term care, not in pipelines. It is a federal jurisdiction. We have to work with the provinces, but Sonia, first, the BC Green Party leader actually believes not in government-run home care. I mean, long-term care should be government-run. I mean, that's a long-term issue, and we can't do it. We have to have standards. So how do we have standards, and how do we make sure they're followed? So if we have money earmarked for long-term care from the federal government to the provincial government, it should be earmarked for that. And if the standards are not met, then the money should be taken back or reneged. There should be standards kept. And then we need to have agreements from the provincial governments that they need to keep up these standards, right? These are privately run homes. And we haven't seen these standards, and they're horrible. So we need to make sure that the homes are retrofitted, because during the heat wave, we saw that, right? We need to retrofit them. We want to make sure that there are proper standards there, there's ventilation, and then there's proper care, and then there's proper staff, and they're properly paid. So we have to have those standards, and we have to work with the provincial governments with that as well. So yeah, so we have to keep those standards, and we make sure that they must be followed. And there has to be partnership of the provincial and federal government, and we're committed in that. And we've also said that, the Green Party believes in working across party lines. So if we're in a minority government, we will make, am I over? Okay.
Oh, did we get a 15-second warning? Thank you very much. Sorry about that. Thank you very much. We'll now move to the New Democratic Party for a response from Ms. Apadura. Thank you. Ms. Apadura?
Sorry, I'm being told the host has stopped my video. Oh, there we go. All right. So once again, during the pandemic, we really came up against the limitations of for-profit long-term care. And we have seen that that the profit motive within for-profit long-term care shows up in the form of inconsistent standards and staffing shortages that created horrific conditions for seniors during the pandemic. And who knows how long we wouldn't have discovered those conditions for if the pandemic hadn't exposed it. So it's very much time to end private for-profit long-term care. And it's time to bring in a national senior strategy to make senior healthcare a priority, reduce isolation, and tackle seniors' poverty. So we do very much, as part of that, need to develop long-term national care standards for home care and long-term care. And as my colleague Sean mentioned earlier, these would be regulated by the same principles as the Canada Health Act. And by doing so, an NDP government would legally protect access to home care and long-term care services and ensure consistent quality of care across the country. So that means we would, of course, coordinate with provincial governments, but we very, very much need a centralized federal long-term care strategy and standards right now in the country. And so the Liberals have obviously failed on this and have kept long-term care in private hands. But the NDP government would ensure that we take profit out of long-term care and for-profit delivery and bring those long-term care homes back under the public umbrella, which includes, a care guarantee for seniors, including, yes, everything that I mentioned before. So it's very important to have a federal strategy for.
Thank you very much, Ms. Apadura. And our next responder to the question will be Mr. Sajan, Liberal Party. The floor is yours.
Thank you. And to answer your question very directly again, so yes, a re-elected Liberal government will develop a long-term care act collaboratively to ensure that seniors are guaranteed the care they deserve no matter where they live. And this is one of the reasons why in a previous government, we appointed a Minister of Seniors. Now, COVID-19 has tragically exposed long-standing issues affecting long-term care facilities across the country and frontline workers who care for the residents. Now, to build a better future for seniors and ensure tragedies like this never happen again, we need to make sure that the conditions of work reflect the care standards that the seniors deserve. Now, even though this is a provincial and territorial responsibility, and with respect to their jurisdictions, we have supported seniors by investing $9 billion over the last 5 years to support safer conditions for seniors and improved wages and working conditions for personal support workers. Now, while the management of long care facilities is under provincial and territorial jurisdiction, we all share a goal of ensuring safer and better care for seniors. We'll work with them to implement strict infection preventions and control measures, including through more provincial and territorial facilities, including inspections at long-term care facilities. In terms of certain examples that I'd like to give is with the examples of improving the quality of availability of long-term care homes and beds, raise wages for personal support workers, including guaranteed minimum wage of at least $25 an hour, and train up to 50,000 new personal support workers for long-term care facilities. Thank you.
Thank you very much, Mr. Sajan. Next, we will hear from the Marxist-Leninist Party, and that's Ms. Jameson.
Hi. Well, first of all, we have the anachronistic system where, the division where the provinces have total responsibility for healthcare. And in most of the provinces, a very large proportion of long-term care is in private hands for profit. This is an example. We have quite a few articles and renewal update about this issue, where the even in The Economist magazine pointed out that Canada has one of the highest rates of privatization of long-term care among the OECD countries, which is interesting. All right, working with provinces to establish long-term care standards. Despite what the cartel parties say, that they're going to talk with the provincial.
We've lost sound from you, Ms. Jameson. Okay. You're back.
That is just words, because the provinces are not willing to actually stop the privatization of long-term care for profit. And I have worked in all levels, from critical care to long-term care, and they are quite horrible in long-term care. So what we need to do is have a different, it goes into the question of who has power to decide. In the present anachronistic system, there's no way that the federal government has even the ability to enforce long-term care standards. We need to go into, who has power. We need a constituent assembly and all these things to make them accountable. The one thing that I would say, if I'm going to pick one thing, is adequate wages for the long-term care workers to lead a dignified, secure life. That will go a long way.
Thank you very much, Ms. Jameson. We'll next hear from the People's Party, and that's Damien Jewett. Mr. Jewett.
Thank you for the question. In general, the People's Party believes in decentralization to allow provinces to manage issues such as healthcare, and we believe this fosters innovation, accountability, and local expertise on healthcare issues. The provinces know best what their healthcare needs are, with cultural and demographic variations across Canada. So I think Ms. Shea and others are proposing even bigger transfers from Ottawa to the provinces. The PPC is actually proposing the opposite. Transfers have already doubled from 20 billion in 2006 to 43 billion this year, and it's not helping. So, because it is in fact, it is the federal government's meddling in healthcare that has caused Canada's healthcare to become so wasteful, unaccountable, inefficient, and ineffective. Wait times are out of control. We're one of the highest spending nations per capita on healthcare. And just to reiterate some points from our platform, for years, the federal government has insisted the provinces satisfy a series of conditions set in the Canada Health Act in exchange for transfer payments. These conditions discourage innovation. The money does not directly fund healthcare services. It is simply added to the province's budgets. This creates a serious accountability problem. And I believe my colleague, Mr. Cook, will be discussing our plan to remove the GST and transfer this to provinces for more direct funding and responsibility. So ultimately, we want the healthcare industry to innovate, and we feel this is best accomplished when provinces have full responsibility and accountability for their respective healthcare plans. If we can foster innovation in healthcare, including long-term care, will be improved over time for all Canadians. Thank you.
Thank you, Mr. Jewett. And our final respondent will be Ms. Shea from the Conservative Party. The floor is yours.
Thank you for the question. It is shameful that 6% of our COVID-related deaths occurred in long-term care homes. We need to make sure that that does not occur, the failures that we saw during COVID does not occur again in our long-term care systems. If elected, the Conservatives will work with the provinces to develop a set of best practices for long-term care homes. And it would be similar to the National Building Code, which will provide guidance for provinces without intruding on their provincial jurisdiction. The Conservatives will then encourage all the provinces to incorporate the results into provincial laws that are clear and enforceable. We need to make sure that long-term care homes meet specific baselines and standards of care. Conservatives will also, in addition to these measures, ensure seniors receive the care they need by devoting $3 billion of infrastructure funding over the next 3 years to renovate long-term care homes across Canada in order to improve the care that residents receive. COVID has also highlighted the chronic shortage of personal support workers, and that is why, if elected, the Conservatives will be boosting the number of personal support workers by providing priority for them in immigration programs. Thank you.
Thank you, Ms. Che. That concludes now our question and answer on the national standards for long-term care. Well, we'll now move to our next question, which will be posed by Betty McGee from the BC Health Coalition. The floor is yours, Ms. McGee.
Thank you, Diane. Good evening, everyone. My name is Betty McGee. I'm the president of the Vancouver Municipal Regional Retirees Association, which is responsible for representing workers in the Vancouver and surrounding areas. This evening, I'm also here representing the BC Health Coalition, which is a provincial network of individuals and organizations that champion a strong public health care system here in BC. Increasingly, seniors are saying that they will do whatever they have to avoid going into long care, with good reason. We want to live in our own homes. Key to aging in place are ensuring that we have the necessary community support services and home care supports that are not only available, but are well funded. The average OECD country currently spends 35% of their long-term care budget on home support services. Shamefully, Canada only spends 13%. A recent report from the Parliamentary Budget Officer estimated that the level of funding needed to bring Canada's spending online with our peer OECD countries would be $5.2 billion per year. My question to the candidates this evening is what is your party's commitment to ensuring the increased funding for home support care?
Thank you, Ms. McGee. We'll now move to the list that I have for responding. As I've indicated, we're rotating who will respond first. And in this question, we will be asking Mr. McQuillan from the New Democratic Party to lead on this one. The floor is yours.
Thank you. We do plan on increasing funding, but we believe in more than just money for money's sake. Now, Mr. Sajjan stated that the Liberal government has promised $500 a year top up for seniors or $1.37 a day, and that's just not very effective. What we need to do is set an overall home care standard, both for the workers and the seniors receiving care, so that all funding is going to be attached to that standard that the provinces need to follow, which also addresses the concern of the Marxist-Leninist candidate. And this means that no matter where you are in the country, you can expect a similar level of care. I know that with my mother-in-law, if we didn't know the specific caregiver for her home care, the level of care provided was not very consistent. You know, some showed up and did very little. And as my wife and I both had a young child at home at the time while caring for her, that inconsistency caused a lot of additional unnecessary grief. So the NDP will improve funding, but alongside that, we want to create a standard for the provinces to follow so that the funding is used effectively across the entire country.
Thank you very much, Mr. McQuillan. We'll now move to the Liberal Party and Mr. Sajan, the floor is yours.
No, thank you very much. As my colleague there stated, some of the points that they raised, it's very important that we work collaboratively with the provinces and territories. Demanding, you got to realize that this, within our constitution in a federalism, the provinces and territories do have responsibility for healthcare, and it's very, very important that we work collaboratively with them. Otherwise, we won't be able to get anything done. So this is why many seniors and Canadians who live with disabilities, they need the freedom to live in their homes. It's something that I personally believe in, something that my parents also need as well. That's why we invested $6 billion into home care and community care, as well as palliative care services. Doubling the home accessibility credit will help with supporting accessible personal spaces for our seniors, as well as putting money back into the pockets of the Canadians who need it most. So we also establishing a 1-800 number for seniors to access centralized information on government support. Establishing an expert panel to create an aging at-home benefit for seniors and families who want to have the option to have their loved ones age at home. And this is extremely important in Canada. This is in conjunction in establishing a safe long-term care act to collaboratively ensure seniors are guaranteed the care they deserve regardless of where they live. Thank you.
Thank you very much, Mr. Sajan. We'll now move to the Marxist-Leninist Party, and that would be Ms. Jameson responding. The floor is yours.
Thank you. Yes, home support and home care are both very important aspects that are very much needed. And if any of you have tried to get adequate home support for somebody who needs it, you know that it's just about impossible. So if the long-term care were deprivatized, and that could be done, the money that has been formally siphoned off into the corporate pockets of those, getting profit out of long-term care could be put into home support and home care. Now, deprivatization, actually, I want to point out that the Hospital Employees Union recently reached a victory in deprivatizing food and cleaning services in the hospital, which had been privatized for almost 20 years. We saw the standards go way, way down in the hospitals with respect to, housekeeping and food services. So that is a very good victory, and it means now that they have security of employment. There will not be, all those things. So that shows that it is possible to deprivatize if there is the political will. And I do want to just mention that it seems the only time people can get nice, adequate care is end of life, palliative care. And that was due to a movement of people who were the hospice movement. And so that's the kind of care that we need in all institutions. But best is if the person can stay at home with adequate home support and home care.
Thank you, Ms. Jameson. We'll now move to the People's Party, and that would be Mr. Cook. The floor is yours.
Thank you very much. The People's Party is in favor of decentralization of government and ensuring that responsibilities are divided between federal, provincial, and municipal governments, as our Constitution suggests. This, of course, means that healthcare, including home care for our seniors, is a provincial responsibility. With decentralization, you would see BC's health system completely managed by the government of BC, who should best know what is needed. There's no one-size-fits-all solution. So why should our healthcare system be managed from Ottawa on any level at all? Victoria, of course, is in a much better position to do this. Our proposal to improve funding for the healthcare would be to eliminate the GST on a national level. This would create space for each province to take up that tax room and tax their citizens directly and use that money to fund their healthcare system. The current level of GST is approximately equal to the current level of health transfers from Ottawa to the provinces. Self-funding removes a layer of bureaucracy from the system, and further that, we would encourage the provinces to innovate. There are many successful models in other developed countries, other OECD nations that have much higher rated healthcare systems than us, using mixed public-private systems. And we would encourage the provinces to find new systems and new efficiencies. The province will be fully responsible for healthcare and fully accountable to the citizens. Obviously, everyone wants to see our seniors cared for. And once our the proposals in our platform for cuts in other places are made, savings from those cuts could obviously go towards improving programs for seniors. The People's Party is the only party not buying votes with promises of increased spending on board or printed money. I would encourage everybody to look at our healthcare platform on our website. Thank you very much.
Thank you very much, Mr. Cook. We'll now move to the Conservative Party, and that would be Ms. Jay. Floor is yours.
Thank you for the important question. There's really no substitute for making your own choices within your own community and in your own home. And that is why the Conservatives' focus is to keep our seniors safe and comfortable in their homes for as long as possible, or for as long as they wish. We want to help seniors to be able to make that choice of aging at home with their loved ones. And we recognize that seniors who choose to live at home need their homes to be accessible and safe. And that is why our home accessibility tax credit raises the limit from $10,000 per household to $10,000 per person. And we recognize that seniors who choose to live at home still need access to home care. And that is why our plan allows seniors or their caregiving children to claim the medical expense tax credit for home care, not just group living. And lastly, the Conservatives recognize that seniors may want the safety and the comfort of living with their children. And that is why we plan a seniors care benefit of $200 per month per household to any Canadian who is living with and taking care of a parent over the age of 70. Thank you very much.
Thank you, Ms. Jay. And the final responder will be from the Green Party, Mr. Popat.
So yeah, my mother has been living with cancer, a form of blood cancer called multiple myeloma, for the last 5 years. She's facing, she also has multiple macular degeneration, so she's losing her eyesight, and she has loss of hearing. She has mobility issues. So she gets home care 4 times a day, and they wanted to cut that, okay? And she gets, to cut it to 2. She gets a shower twice a week. Now, what if something happens along the week, right? Who's going to clean her up and take a shower? Is this not? This is what's been happening under the Conservative Liberal governments, right? This is what's going on. So home care was by private company. It's just been bought over by Fraser Health Authority. And so hopefully things will get better. I also work for Fraser Health Authority. So yeah, we need to have better standards, and we need to have more funding for home care. And we need to have better training for people who give home care. So we do need standards along with long-term living. I think they're connected, that in terms of long-term living and home care, we do need to have standards, and we need to provide funding, work in partnership with the provincial governments. We do have that commitment from the BC Green Party. Sonia Fortuno has been advocating for government commitment to long-term care and also to home care. And that's what we need to do. Thank you.
Thank you, Mr. Popat. That concludes the question on home support. And we'll now move to the final question, which will be posed by Andrea Kronbein. And Ms. Kronbein?
Hi, good evening. My name is Andrea Kronbein. I am Seniors Coordinator for Marpole Oakridge Family Place. Marpole Oakridge Family Place supports families and seniors with information, education, and crisis response. We also host a chapter of the BC Community Response Network, which addresses through training and referral elder abuse and neglect. Family Place is also the co-lead of the South Vancouver Seniors Network, a collaborating group of organizations working for seniors through services and through advocacy. My question is, many seniors suffer from poor housing or lack of housing due to low housing stock, long waiting lists for housing, and ever more prevalent abuse and neglect at the hands of landlords. What measures would your party take to promote the creation of suitable, safe, and affordable housing designed to enable seniors to age in place? Thank you.
Thank you, Ms. Crombine. We'll now move to the candidates to respond to this question. And the first party we'll hear from is the Liberal Party, and that's Mr. Sajan. The floor is yours.
I know. Thank you very much for the question. And since 2015, we have created Canada's National Housing Strategy, which is an ambitious 10-year plan to invest over $72 billion to build supply, making housing affordable and address chronic homelessness. Now, we also introduced legislation recognizing the right of Canadians to access adequate housing. We also signed a Canada Housing Benefit Agreement with every province and territory, totaling $4 billion in cost match funding, and helped over 300,000 Canadians pay rent. We also launched the Rapid Housing Initiative, investing $2.5 billion to create at least 9,200 new units of affordable housing across Canada. And in budget 2021, we launched the Rapid Housing Initiative, a $1 billion commitment to address the urgent housing needs of Canadians, including $916 million in affordable housing committed to Vancouver alone. Now, we committed $5.3 million in existing cooperative housing as well. Now, thanks to our relationship with all levels of government, we've renewed a federal cooperative housing agreement, keeping 4,300 units available to Vancouverites. As the question acknowledged, a part of the problem is lack of supply, and a re-elected Liberal government will build or revitalize an additional 250,000 homes over 4 years. This is in addition to 285,000 homes currently being built each year. This will mean nearly 1.4 million homes will be built, preserved, or revitalized by 2025-2026 under a re-elected Liberal government. Now, we will permanently increase funding to the National Housing Cooperation Investment with Fund by a total of $2.7 billion over 4 years. That's more than double its current allocation. And finally, we have committed to funding specific projects which addresses housing supply, like the Jewish Community Centre revitalization. Our re-elected Liberal government will move forward and invest $25 million alone in this.
Thank you, Mr. Sajan. We'll now move to the Marxist-Leninist Party, and Ms. Jameson, floor is yours.
Thank you. Housing is a right. It's a basic human right. And profit making and investment should have no place in housing, the profit motive. So the important question, part of that question, all of it was important, but the aging in place. Now there are, I am aware of about 3 centers for elderly people where people can age in place. As you all probably know, elderly, especially the fragile elderly, do not take well to being moved, period, let alone into some place like long-term care. So these 3 places that I'm thinking of seem to be pockets where it is possible to have a person start with independent living and then move into different levels of care as they need it. Again, this is part of the social programs and the right of seniors to a dignified life. So, I'll leave it at that, because in the closing statement, I'd like to say, again, stress where is the funding going to come from for the social programs.
Thank you, Ms. Jameson. We'll now move to the People's Party, and that's Mr. Cook will be next. The floor is yours.
Thank you very much. Canada's housing market, and specifically the housing markets in Greater Vancouver and Greater Toronto, have been under heavy pressure for a long time. Governments and campaigning politicians talk of cooling the market, but their actions don't match their words. One driver of increasing house prices is demand. Over 40% of immigrants to Canada settle in Vancouver and Toronto, increasing demand on the market and helping to drive up housing costs. Any politician who tells you he wants to cool off the housing market while promoting increased immigration levels isn't being honest with you. Our immigration policy of limiting immigrants to levels lower than currently allowed will help to cool that demand. Another segment of the senior population we discuss is those who own homes but are on fixed incomes and have seen their buying power evaporate due to inflation. There's a lot of chatter now about the possibility of the Liberals, if re-elected, taxing the sales of homes. Many seniors may have used the equity in their homes to finance their retirements with a reasonable expectation that the eventual sale will be tax-free, and this will be greatly affected if their capital gains are re-taxed. Capital gains taxes have only existed in Canada since 1972, and one's primary residence has always been exempt from these taxes. A change to this policy would be a huge new tax and greatly affect many in our communities in a negative way. I've heard Liberal spokespeople insist that we're not going to tax your homes, but that doesn't really get to the issue. Will Mr. Sejan or someone else from the Liberal Party unequivocally state that the Liberals will not change the current law and tax the capital gains on our personal residences? Provinces also have to work harder to curb speculation and money laundering through our housing markets by foreign nationals. The People's Party of Canada is the only federal party not trying to buy votes with promises of increased spending or borrowed or printed money. Please look at the website to look at our full platform. Thank you.
Thank you very much. You will now move to the Conservative Party, and that would be Ms. Che. Floor is yours.
Canada faces an affordability crisis and housing affordability crisis, a crisis that Liberals have failed to resolve in the last 6 years. As recently noted by the Parliamentary Budget Officer, the Liberal government, although it spent $70 billion on its housing policy, on its housing strategy, this strategy has had limited impact on our housing crisis. The Conservatives recognize that our most vulnerable, especially our seniors, are squeezed on housing. And unlike the other parties, our plan will reduce waiting lists, reduce red tape, and create affordable housing units as quickly as possible. The limited impact of the Liberals' housing strategy demonstrates that it is not enough to help purchasers on the demand side. We need to increase supply and to reduce the cost of land and development. The Conservatives have committed to building 1 million homes over the next 3 years. We are the only party who has committed to releasing 15% of government-held real estate for the development of affordable housing. And we're the only party that recognizes that transit funding can be an effective tool to drive municipal level action. Specifically, the Conservatives will require municipalities to increase density along key transit lines in order to receive additional transit funding. Lastly, to free up existing inventory, the Conservatives were the first to propose a ban on foreign ownership for at least the next 2 years for foreigners who do not intend to live in the home. We need real strategies for housing, and we need collaboration between the public and the private sectors. As we've seen in the last 6 years, throwing money at the problem will not solve the housing crisis in Canada.
Thank you, Ms. Che. We'll now move to the Green Party. Mr. Popak, floor is yours.
The problem is when the established party talk about affordable housing, it's not affordable for everyone, right? And people who live in low income, seniors particularly, many cannot afford their notion of affordable housing. What we need is subsidized social housing, co-op housing, which the other parties are not talking about, which includes seniors specific housing. If you look at other parties, they have all kinds of money for homeowners, this homeowners grants, homeowners, there's nothing for renters, right? We're proposing that we give grants for renters to retrofit appliances, because I live in an old apartment, but my landlord's not going to fix it for me. We had a heat wave, right? And we don't have ventilation and things like that. So we need to have grants for renters so we can fix things. We need senior-specific housing. We need social housing. That's affordable housing. We need co-op housing. We have co-op housing now that no longer have subsidies, right? So people living in co-op houses have to pay market rents. This is under the current system. And now this government wants another mandate from us. I think we need to change it up. And I think we need to have a minority government where whoever the government is has to listen and work collaboratively. So they listen to us, and then we have senior housing, and we have social housing, and we have grants for renters and for everybody to be more equitable. And that's what we're talking about here in the Green Party. Thank you so much.
Thank you, Mr. Popat. And then our last responder will be from the New Democratic Party and Ms. Appadura. Floor is yours.
Thanks. Can I get my video? Oh, there we go. Thanks for the question. I have been speaking to seniors at the doors and hearing some truly sad stories, including a senior who told me last night that the isolation during the pandemic led him to a place where he felt that he was disintegrating because he had a lack of community and a lack of people around him, and just sort of had to stay home and live this really isolated life. And a housing strategy is part of that. Housing strategy, if implemented correctly, can create community and can create a sense of living close to people and a sense of having neighbors that you can rely on. Canada's in the midst of a national housing crisis right now that's impacting every area of the country. The Liberals have created it with help from the Conservatives before them, and it's frankly out of control. Right now, we have 1.6 million Canadian households spending more than 30% of their income on housing, when actually the expert economists say that you should spend no more than 25% of your income on housing. And this puts us as the country in the G7 with the fastest growing house prices, and is a trend that shows no signs of slowing. So this is pretty shameful, given that we are Canada and we're supposed to be addressing inequality for all. I've heard a lot of band-aid solutions proposed tonight and from the Liberal platform, small payments here and there that don't address the root causes. Some of these incremental measures have actually spectacularly backfired, like people losing their guaranteed income after claiming CERB. So the reality is that the Liberal housing market is simply too small to make a real difference. What we need is a supply side investment that is a mix of affordable and co-op and walkable and dense housing, as well as demand side solutions to curb these predatory practices of flipping and speculation that are driving prices up for everyone. So homes are for living in, and the housing market is not to be treated like.
Thank you, Ms. Appadura. That now concludes all of the questions, and the final one being the seniors' housing needs. I would like to thank the co-host organizations for the questions that they prepared for the candidates. And I'd also like to thank all of the candidates for their responses that they have provided to us this evening. The next part of our program is for the candidates to bring their closing remarks. Each of the candidates, and that will be all 8 of the candidates here this evening, will have 2 minutes each to do their closing remarks. And again, the order of the closing was by random order. So that order will now start with the Green Party and Mr. Popat. The floor is yours.
Thank you so much for organizing this evening today. It's such an important issue, seniors issue. I'm 58, I'm almost a senior. And the seniors is a growing population, so we really need to invest into senior care. It is a priority, and I think that's been neglected. And we saw this in the pandemic. I've been looking after my mom and my dad, and also myself, and I know that this is something we need to do. And so the commitment has to be there, and the Green Party has a commitment. Both at the Green Party of Canada and the Green Party of BC have been advocating for seniors care, and that should be a commitment. We're spending money on buying pipelines. Why can we not spend money on senior care and long-term care? in home care, in senior housing, right? In pharmacare, in dental care, in other types of holistic medicine that is not currently covered. I'm a counselor, I'm a therapeutic counselor, I'm a good listener, I'm also a good caseworker. If elected, I will represent you, listen to your concerns, and I propose to you that we need a minority government. So the government actually listens to us. And I'm committed to as a member of the Green Party, we will hold this government accountable for working for seniors, for long-term care, for home care, and for seniors housing, and for pharmacare. We need to do that, and we need to make sure that we make our support as a condition of minority government support for critical issues like seniors care. Thank you so much for your time.
Thank you, Mr. Popat. We'll now move to the Marxist-Leninist Party, and that would be Ms. Jameson. Floor is yours. Ms. Jameson, are you there?
Yes, I'm having trouble starting the video.
Okay. You're on
okay,
now.
Thank you. Yeah. Okay, so when we were talking to people on the street in the past couple of weeks, most of them have been very angry about what they consider an irresponsibly called election in the middle of a pandemic and wildfires in BC and various other things. They are very, very frustrated with the government and with a situation where their only choice is choosing between cartel parties that do not support them, that do not represent them. So for the moment, in this particular 44th general election, our position, we agree with Mr. Popat that actually it should be a minority government, whatever cartel party is at the head of that. But in the long term, we need to work for democratic renewal, fund the political process, not political parties, elect a constituent assembly, figure out how we're going to do that, adopt a modern constitution by referendum that does guarantee the rights of all, including, of course, seniors with their right to a dignified life. And I would like to reiterate that we need to have an anti-war government. We need to have an anti-war government, and we need to renew the political process so that people can become the decision makers. Please see our website, cpcml.ca, for further details on that. And I really thank the organizers for this important discussion, making seniors issues, the right to a dignified life, an election issue. Thank you.
Thank you very much, Ms. Jameson. And we'll now move to Mr. Jewett for the People's Party. Floor is yours.
Thank you. The PPC has faith in Canadians and believe they are capable of making important decisions for themselves. There will always be care and housing provisions for Canadians, including seniors. But regardless of shared responsibilities between jurisdictions or public-private splits, we'd like to move toward empowering individuals and minimizing reliance on federal government meddling. So just to close out, I'd like to shift focus a bit and talk about the future of Canada. So we believe that Canadian seniors should be able to retire comfortably with the financial security they need. In addition, we believe a major concern of seniors and retirees is what kind of country they're leaving behind. They want to know that their children and grandchildren will be taken care of. And the best way to achieve this is through an economically strong and fiscally prudent future for Canada. So when thinking about my party's policies, take a moment to consider the implications on the future of Canada as you hear about the massive ineffective spending programs that will be proposed by the other parties. Please take a look at our website, peoplespartyofcanada.ca, for our full platform. And thank you for inviting us today.
Thank you, Mr. Jewett. We'll next hear from Mr. McQuillan from the New Democratic Party. Floor is yours.
Thank you, everyone. Now, I know in my experience as a caregiver that what's most important to anyone is quality of life. And I ask you, has your quality of life significantly improved in recent memory? So the claim by the Liberal candidate that they have started Pharmacare is false, as $35 million to PEI over 4 years to bring it up to date with the rest of the country is not the same thing as universal coverage. And nor is there affordable housing properly associated with the median income. It's still out of reach for most people. So in everything I do, I try and look 7 generations ahead. What actions I take now will affect future generations. And now this is why I want to help create a foundation for future generations. And that comes from supports for people. True pharmacare, dental care, eye care, mental health supports. And again, with those mental health supports, that means a sense of community and a sense of belonging. Wage and wealth inequality is one of the largest problems facing society, and it affects absolutely everything, including climate change. And I know through myself, Jagmeet Singh, and the NDP that we will fight the inequality that has only increased the struggle of everyday people. We have given the Conservatives and Liberals a chance at running the country, and I know that the future of our country lies with the NDP. Thank you.
Thank you very much. We'll now move to Ms. Shea with the Conservative Party. Floor is yours.
We simply cannot afford more of the same. We can't afford more reckless spending that will leave Canada with high levels of debt and unemployment. This election is about which party has the best plan to get Canada back on its feet and to rebuild our economy, our jobs, and our way of life. I'm confident that as your member of parliament, together with the Conservative Party of Canada, we will bring the change this country needs. We will resolve the many challenges facing Vancouver Granville and its residents, including issues relating to affordability, economic recovery, climate change, mental health, and public safety. As someone who grew up in Vancouver Granville, went to school in this riding, and who now has legal practice in this riding, I have personally experienced and seen the challenges facing our communities here in this riding. I've worked hard to advocate for the interests of seniors in BC as a lawyer, and I will work even harder to advocate for BC seniors as your representative in Ottawa. If elected, I'm committed to serving as a strong voice in Ottawa for you and this community. Respecting our elders is deeply personal for me, and I pledge to be accessible and responsive to your needs and your concerns in Ottawa. If anyone has questions today, please feel free to email me at info@kaylinchi.ca. I would love to hear from you and to earn your support. Thank you for your time. Thank you for being here with us. And thank you for the organizers for inviting me today.
Thank you, Ms. Shea. We'll now move to Mr. Cook from the People's Party. Floor is yours.
Thank you very much. I'd like to thank the organizers for hosting this forum. It's great to be able to hear all the other candidates' views and give this opportunity for residents of Vancouver South and Vancouver Granville to listen to what we have to say. I'm not a politician. I'm a small business owner. I've been a 20-year resident of Vancouver South. I raised my children here, and I entered this campaign because I'm concerned about the future of our country. I joined the People's Party because I believe in the party's core principles of freedom, fairness, respect, and personal responsibility. Unlike the legacy parties, we're not buying your vote with massive new spending promises financed by either new taxes or inflationary policies of money printing like we've seen during the COVID-19 pandemic. Our country can't afford to go on this way. The way it's being managed currently, it's unreasonable, and we're already seeing increases in inflation. These inflationary policies hurt seniors on fixed income and low-income Canadians disproportionately. Making sure our money retains its value is key to ensuring low and fixed income Canadians don't get left behind. If anybody has any further questions for me, I can be reached at my email, anthonycookppc@gmail.com. And I would encourage everyone to look at our full platform at our website, peoplespartyofcanada.ca. Thank you very much for having me this evening. It's been a pleasure.
Thank you, Mr. Cook. We'll now move to Mr. Sarjan from the Liberal Party. The floor is yours.
Thank you very much. And I want to just thank the organizers for inviting me. But I also want to address Mr. Cook's question directly about the tax on primary residence. That is an absolute lie that has been circulated by the Conservatives in every election. And we have said this outright is an outright lie. It's misinformation, and we already have enough misinformation to deal with from foreign powers. We should not be kind of perpetuated in this type of things internally inside Canada by the Conservatives. In my closing, I just want to say a re-elected Liberal government will continue making life more affordable for seniors by increasing the guaranteed income supplement by $500 for singles seniors and $750 for senior couples. Will help seniors stay in their homes longer and work with the provinces and territories to improve long-term care for seniors, that they are safe and comfortable wherever they live. Now, this builds on actions we've taken before and during the pandemic, which include restoring retirement age to 65 from 67 after the Conservatives raised it when they were in power. We've also increasing GIS from 900,000 seniors and lifting 57,000 seniors out of poverty and providing more than $900 for single seniors and $1,500 for senior couples, on top of regular benefits for low-income seniors to get through this pandemic. We have always had the seniors back through this pandemic and supporting them when they needed it the most. We have to keep moving forward for all Canadians and especially seniors. Thank you.
Thank you very much, Mr. Sajan. And finally, we'll hear from Ms. Zapadura, New Democratic Party. Floor is yours.
Well, I will have to echo those thanks to the organizers. This was a really interesting discussion for me because to me, seniors issues bring together these interrelated problems of housing, medical care, and unaffordability. And these things are essential to life, and seniors deserve to have these things guaranteed by their government and not left to the whims of the market and to corporate interests. Some things just should be guaranteed, and some things should be under the public umbrella. And long-term care for seniors who have spent their lives working for us should be one of those things. And housing and medical care for seniors should also be those things. I've been hearing too many stories at the doors in Vancouver Granville of seniors who are feeling the pinch of unaffordability. And it's clear that federal leadership currently is not standing up for them and is instead throwing piecemeal and incremental measures as electoral promises without addressing the root causes. I hope we can begin to see that the essential care work of seniors should not be accompanied by a profit motive. And we have a clear recent example in the pandemic of how this profit motive doesn't serve seniors' health, safety, or happiness. Incremental solutions have failed, and yet most parties continue to put them forward in the interest of fiscal responsibility. But to me, this is a false dichotomy, because to be actually fiscal responsible, we would bring senior care back under the public umbrella, which would save money and create stronger communities in the long run. Elders are such an important part of my culture, and to me, these issues are at the heart of the change that we need to make. So thank you so much to the organizers for this privilege of engaging in respectful political dialogue.
Thank you so much. And thank you again to all of the candidates for your closing remarks and for your full participation in our event this evening. It's been a pleasure to, I'm sure for all of us, to meet you and to see you face to face. And we thank you so much. I will now close off as your moderator and turn this session over for closing remarks from Ms. Sheila Pither, who is the president of COSCO. Over to you, Ms. Pither.
Thank you. I think tonight has been an example of democracy in action. It's been respectful and it's been forthright. And I would like to thank JSA for inviting COSCO to participate. So I also want to thank Diane, our moderator, who I believe showed great patience and also a lovely way of encouraging people to express themselves. And the candidates and the people who asked the questions, the technical people who made sure that we could do what we wanted to do. I do want to thank you all, and I do want to say that I don't think we're voting just for now, we're voting for the future. And we can do that in Canada without coercion and in safety, and that's a blessing in my view. So thank you again. And we are voting on the 20th. Many have probably already done that, but it's going to be an exciting day for us. Thank you.
Thank you. And I guess I should be reminding people again, as we said earlier on, I know some of the candidates have said they've given you your webmail address, but please do send in your questions to margot@jsalliance.org. Thank you, everyone, for being with us this evening.